I'm proud to be here with my colleagues from the Senate. You know that, as Senator Mikulski, our leader, has said often, we stand ready to defend women and children, and we're here again doing that. Now, since the beginning of this budget battle, what have the Republicans said? They said, this debate is about spending. Guess what? Their actions make it clear that it hasn't been about spending, because we really basically went so far toward them on spending. The issues really are ideological, and their agenda puts women at risk and their families at risk. Imagine, as a condition of keeping the government open, the Republicans demanded that the Senate hold two votes, a vote to defund Planned Parenthood and a vote to defund health care reform. Now, we know, again, that we went about 78% in their direction on cuts. So this wasn't about cuts. They basically are going after women and children. And by the way, I would agree, in the Ryan budget, that budget gives a shaft to women and children, and just in case that wasn't enough, to seniors and the middle class. So you're going to see us quite a lot here, because everything is at stake. Everything that we fought for our whole careers, whether they started on city councils or boards of supervisors or state legislatures or the House, we're going to be here because we know that women and children and their families need a voice here. We intend to be that voice. Now, Planned Parenthood is not exactly a new organization. You know how long it's been around? 95 years. Wow. 95 years. And it has provided basic health care services such as breast exams and STD tests and birth control and more to women and to men. And the reason we reiterate it, you may say, gee, I know all this. Well, John Kyle obviously didn't know all this when he made a huge factual error and turned around the numbers. It's actually 97% of the services of Planned Parenthood nationwide have nothing to do with abortion. And federal dollars have zero to do with abortion. So this isn't about abortion, because that fight was waged a long time ago. No federal funds can be used for abortion. So not one penny that Planned Parenthood spends on that small part of what they do, 3%, has anything to do with federal funds. So you have to then look behind all these facts and realize that this is really an attack on women and their families. I'm just going to tell a couple of short stories, and then I'm going to yield to another one of my wonderful colleagues here. Planned Parenthood in my state serves more than 750,000 patients. That's more than some states have.
Wow.
Yeah, 750,000 patients. One of them is Nicole Sandoval of Pasadena, California. And she wrote and she said, please support Planned Parenthood. Because she said, when I was 23 years old and I had no insurance, Planned Parenthood was there for me. It caught my cervical cancer, she said, early enough to treat it, and it saved my life. So I'm here today, and we're here today, to stand up for Nicole. Barbara Haya from Oakland wrote, she said when she was a student with limited funds, she was denied health insurance because of a pre-existing condition. Planned Parenthood was Barbara's only source of basic health care. When she needed cancer screenings, an annual exam, Planned Parenthood was there, and I'm here, and we're here to stand with Barbara. So I will say another point made by our unbelievable leader here is that when you look at defunding health care, it's also about women. Do you know in some states before this law passed, being a woman was a pre-existing condition? Okay? Being a victim of domestic violence was a pre-existing condition. Are you kidding? They want to say that we should repeal those protections. And we're here to say, no way. So I'm proud to stand with the people of my state and with the women of the Senate, and I hope we have a good vote.